The intravitreal injections have been there since the early mid-2000s, and you can treat a whole host of conditions with that. Most commonly, we treat wet age-related macular degeneration with intravitreal injections. We can treat diabetic eye disease, particularly diabetic macular edema, central retinal vein occlusions with macular edema, branch retinal vein occlusions with macular edema. Patients who are very short-sighted get abnormal blood vessels at the back of the eye. We can treat those as well. And also there are certain patients who develop this kind of conditions that are similar to wet AMD, but it's not wet AMD. We can use those injections for those conditions as well. So, and there are different ways and chemicals that are used as part of this intravitreal injection therapy. Depends, again, on what type of injections it is. So if it is for wet macular degeneration, we have a chemical called anti-VEGF. These are little minuscule amounts of antibody that we inject in the eye. Depending on the chemical, depending on how long is there, what we use the term half-life, you can need an injection between 4 to 6 weeks. And there are some chemicals that have a benefit for around 12 to 16 weeks. The newer ones that have just arrived and are available nowadays. So it depends on the chemical we're using. On the other hand, you also have got steroid implants. There is one steroid implant which lasts between 4 to 6 months, the benefit. There is another one that lasts between 2 to 3 years, but they have their own side effects. So it's about which one we use for what condition and what is the state of the eye when we do these injections. So accordingly, the duration of effect can vary from person to person and eye to eye. I usually advise my patients that when they have the intravitreal injections, that they just go home and rest, because a lot has been done to the eye. We make it seem like it's very simple, but it's best for quicker recovery if they go home and maybe if they have discomfort, take a couple of paracetamol. I usually advise a cool pack on the eye and just to go home and have something to eat, paracetamol, and to sleep it out. They recover much faster. I've noted that when patients go home and get going doing work or go back to work, they're usually more uncomfortable for a few more days than is necessary, basically. Yes, unfortunately, every time we do something to a patient or to a person, there is always an element of risk. Most commonly, it can be like a retinal tear or retinal detachment. I probably see in my patient group maybe one a year, keeping in mind I usually have around 4,000 injections per year in my patient group. So that's not too high. You can have, there's always a risk of infections, but thankfully I haven't seen one in my practice now for at least 5 years. You can have the common red eye or inflammation, just a discomfort, floaters, flashing lights. Those tend to be more common after these injections. When I get asked the question whether the intravitreal injections are painful for patients, I usually say yes, in a way. Again, varies from patient to patient, depends where they are on that day, what is their level of pain threshold. I find that patients who are very stressed have a lower pain threshold, they feel more uncomfortable. But to be honest, there's a level of discomfort when they have it. And some patients take it very well, and some patients need a bit more time to recover after the treatment. Yes.